Hello, my name is Refilwe Mpai. I am a current student at McGill University. I recently completed my bachelor's in psychology and I'll be going on to do my master's in neuroscience. So before I begin speaking, just a little disclaimer, I am by no means a professional or an expert in the field. However, I do hold mental health and mental illness very near and dear to my heart. So mental health and mental illness are two terms that are often used interchangeably. However, they refer to two different things, and by distinguishing them and understanding the differences between these two, hopefully we can demystify mental illness. So to begin, mental health refers to our emotional and psychological state. So our social well-being, how we think and feel about ourselves, and how we interact with others. Mental health refers to our emotions, thoughts, and feelings. Everyone has mental health, but not everybody will go on to have a mental illness. When we think about good mental health, it's not about feeling good and confident 100% of the time and ignoring any problems that may arise, but rather it is about being resilient and better able to cope with any of life's challenges and stresses, and also to form meaningful relationships. So just as people may experience physical health problems throughout the course of their lives, they may also experience mental health problems throughout the course of their lives. But this is not the same as mental illness. So to liken it to physical health and physical illness, I'd give the example that having a tummy ache at a particular point in time is not the same as having IBS, or irritable bowel syndrome. So the tummy ache being poorer physical health and IBS being the physical illness. Moving on to mental illness, this refers to a wide range of disorders that affect mood, thinking, and behavior, and are often associated with feelings of distress and trouble functioning at work, home, and in social situations. Examples of mental illnesses are depression, anxiety disorders, personality disorders, schizophrenia, mood disorders such as bipolar, trauma disorders like PTSD or post-traumatic stress disorder, eating disorders, and addictive disorders. So there's quite a range of them. And signs and symptoms may vary. So it could be changes in sleep, appetite, or energy level, or severe mood swings, feeling sad and hopeless, persistent thoughts or compulsions, hearing voices, social withdrawal, having trouble performing everyday tasks, or wanting to hurt oneself or others. Anyone can be affected by a mental illness regardless of age, gender, race, ethnicity, religion. Poor mental health can lead to mental illness, but not always. There are other factors that interact with each other that would determine whether you'd go on to develop a mental illness or not. And these are things like biological factors, so genes, maybe that there's a history of a mental illness in your family, or brain chemistry, or maybe even being in an environment that is just not conducive to your mental well-being. So experiences of trauma or abuse. It is possible to have good mental health even with a diagnosis of mental illness. And to go back to physical health and physical illness, it's possible to have good physical health, so you work out and you eat well and you sleep well, but still have a physical illness diagnosis. Both mental illnesses and physical illnesses are episodic, meaning that there are periods or episodes of ill health and periods of better health. And they can be comorbid, meaning that they co-occur. In fact, there were a couple of studies published between 2008 and 2014 that showed that between 38 and 58% of HIV-positive patients in sub-Saharan Africa also showed depressive symptoms. So that's physical illness being comorbid with a mental illness. The mental illnesses and physical illnesses can also affect each other. So another study published a couple years later showed that depression and anxiety disorders can actually accelerate the progression of HIV. So they're so intertwined and so related, and I think we need to treat people with mental illnesses with the same care and support that we do people with physical illnesses. So just as physical illnesses require medications and physical therapies and such for people to get better, people with mental illnesses also require medications and therapies in order to get better. And friends and family can play a very important role in ensuring that people receive the treatments and services that they need. A very important thing to note is that mental illness is not a weakness by any means or a character flaw. People with mental illnesses do not choose to have them. They are not lazy and they can't just snap out of it. And it is not the case that someone with mental illness is not strong enough to cope with life's challenges. In fact, I've seen people who have been diagnosed with mental illnesses go on to achieve great and wonderful things. So it is by no means a weakness. And as a society, I believe that we need to watch the language we use when we refer to mental illnesses. So stop calling people who have been diagnosed as crazy or psycho or insane, and stay away from phrases like, oh, she's so bipolar, to someone who had a mood shift, or I almost had a panic attack when someone gives you a fright, or they're so OCD, to refer to somebody who's neat or very particular about things, or phrases like I'm so depressed when you're really just sad. Because to anyone with a mental illness, this really devalues their experience and just adds to the stigma that exists around mental illness. So, to conclude, I just want to say that when we begin to see mental illnesses as a disease of the brain, in the same way that we see lung cancer as a disease of the lungs, we can reduce the stigma that is associated with mental illness. Thank you.